Today I'm doing a blood draw for PRP. I typically will take anywhere from 4 to 6 9 milliliter vials depending on the procedure. After placing the tourniquet and determining which artery I'm going to use an alcohol swab in the site. I let it dry for 30 seconds. Don't ever blow or wave your hand to make it dry faster because that will just reintroduce germs into that area. I then puncture the artery at a 90-degree angle. Once I have my desired amount of blood draw, the tubes are mixed by inverting them at a casual pace 8 to 10 times each before being packed directly into the centrifuge. Today, we are extracting 3 teeth and placing 3 implants, so I will be taking 4 vials in total. 3 are going to be red top vacutainers, and those will be for PRF membrane, and 1 blue top, which will be for PRF serum to make sticky bone. Each of the tubes must be counterbalanced with a tube of equal volume of liquid for proper operation in the centrifuge. The blue tubes are spun in the centrifuge at 2400 RPMs for 3 minutes to process the PRP into a serum, which is used to mix with cadaver bone, and that's how we make our sticky bone for grafting. Here you'll see I removed my blue tube, so now I will use an empty vacutainer with water to balance out my odd number of red tubes. I will then place them opposite from each other so that each tube is equilibrated. I then add 9 more minutes to these red tubes to get spun for a total of 12 minutes. While those are spinning, I am going to start extracting just the yellow serum from the top of the collection tube. I will then mix this with cadaver particulate bone to make sticky bone for grafting. Some benefits of platelet-rich plasma in dentistry are it stimulates cell growth, helps build connective tissues, helps form hard tissue like bone, and reduces inflammation and lowers risk of infection. For example, after a dental extraction, PRP helps quickly heal the gum area involved and also encourages the buildup of more bone where the tooth was removed. This in turn makes the area a more solid foundation for future implant placement. We are now going to make our PRF membranes, which are basically a blood clot that is rich in cells and growth factors. It acts as a natural bioactive barrier, facilitating natural tissue regeneration and healing. These membranes are placed over the sticky bone in the surgical site. The membranes are then carefully extracted from each tube and trimmed at an angle to be sure that you are just getting a majority of the fibrin only. The membranes are then compressed before placement in surgery. Thanks for watching. I hope this was informative. If you liked it, please give it a like and subscribe. And as always, remember to be better than yesterday. Bye!